Hello, my name is Lee Wilson. I'm a general dentist here in Knoxville, and I'm joined today with Dr. Kristopher Kimball. Dr. Kimball is a faculty member in the Department of OB/GYN at University of Tennessee Medical Center in the Graduate School of Medicine. Dr. Kimball is also a GYN oncologist, which is a doctor who takes care of cancer-related disease associated with a woman's reproductive system and the associated structures. Dr. Kimball is also the program director for the residency program associated with his department. And I am associated at UT also in the Department of General Dentistry. So we are here today to talk about a disease that affects both of our practices. And Dr. Kimball deals with it every day. And this is something called HPV, or human papillomavirus. So Dr. Kimball, what is HPV?
So as you said, human papillomavirus, it is one of the very common viruses that humans come in contact. This one happens to be sexually transmitted, but it is as common as the common cold. In fact, 80% of men and women will be exposed to high-risk types of HPV throughout their lifetime. There's about 140 different serotypes. We really care about 15 of them because those are the ones that are associated with cancers.
And these cancers would affect a lady in what areas?
Well, it's a good question because it's not just women, okay? So this affects cervical cancer, and that's really why this vaccine was ultimately developed, but it also includes the vulva and vagina, but we also know that it is associated with cancers of the anus and then also the oropharyngeal area.
That's correct, and that's where our two paths cross because we know that the vaccination for HPV is called Gardasil, and as well as there's another one. Is that correct?
Correct. It's really Gardasil 9, and there were several on the market. This has been available since 2003, so we're getting into 20 years worth of availability. And what this most recent and really the only available now in this country vaccine covers for 9 different types, serotypes they're called, of HPV. 7 of those would be those high-risk cancer-causing type, and then 2 of those are actually associated with condyloma or genital warts.
Right. So who needs to get a vaccine?
That's a really good question. In my opinion, everyone. This was when it was first rolled out in early 2000s. It was for women, really girls, starting at age 13. It is available to be received by boys and girls as early as age 9. The recommendation is now at age 11. If we can get that vaccine series done before they turn 15, then they only need 2 of the 3 doses. After that, you do need the 3 doses to become fully vaccinated.
So we know the vaccine is effective, and it's effective. The most effective is you get it before you are sexually active. Is that correct?
Yeah, there's actually several components to that. So certainly if we can be vaccinated before exposure, that's huge. Second of all, however, though, we know that younger people have a much more robust response to the vaccine. And so that's why that 2 and 3 dose requirements. But certainly if we can be vaccinated before exposure, that is huge. And you were talking about effectiveness. We know that if vaccinated before exposure, we can cut down rates of these cancers, the associated genital warts, and even the precancerous disease that has tons of extra diagnostic tests and workup associated with it by up to 90%. And so it is a huge difference maker in the world of avoiding these cancers.
Yes. So a little bit about crossing our paths. We know that the HPV virus can cause problems in the oral cavity, as you mentioned, tongue, associated structures, oropharynx, other head and neck cancers. And the reason that these do cross is because of sexual contact. And we know that we have seen an uptick in the amount of occurrence over the last 10 years or 15 years of those associated with the head and neck. So are we able to try to control that with the vaccination?
There's no question that vaccines are probably going to try and limit that in some ways. Certainly behavior limitations could also change that. In my personal practice, I don't think that that's a useful way to try and change people's behavior. Rather, let's try and do this very safe and easily available vaccine to try and change those rates.
Yeah. And so you mentioned that young boys and young girls can take the vaccine. How important it is for the young boys?
Well, you know, I don't think I mentioned in my original series that this is also associated with penile cancer. So penile cancer, anal cancer, and then oral pharyngeal, those are all cancers that men can get as they go along. And so I think it's just as important for men as it is for women to receive this vaccine. Again, this is one of the few vaccines that we have that we know can prevent cancers, both for males and females.
Dr. Kimball, why do you think that Knoxville is lagging behind on vaccination rates for the young people in this area?
It's a really good question, and in fact, I think that the answer is multifaceted. When you compare the United States to other countries, like, for example, Australia, where they have a mandate in place for certain levels of schooling, they're close to 100% participation. In the United States, we don't have that, and so across the country, at best, maybe 50%. Some states as high as 80% vaccination, both by females. In this region, we are as low as 30%, and so I think that it's multifaceted. Early on in the process, it was related to religious beliefs, and also it's very hard to imagine your young child ever being sexually active, and so I think that had some play in it. I think over the last 5 to 10 years, it's really been associated with some, what I would describe as misinformation that's disseminated over social media as well. There's no question that anytime somebody chooses not to get a vaccine that we think is useful and safe, there's some fear component to that. And so I really put it squarely back on us. We're not educating enough. We're not educating well enough. We may not be educating the right people. And then the final factor of that is that this is a disease that I treat, but I very rarely have 9-year-olds in my office to recommend that vaccine. And so it's a multi-pronged approach that's necessary to have a good program to roll out an effective HPV vaccine protocol.
Yeah. So it probably would be advantageous to the vaccination level if we were able to approach this subject with parents in pediatric offices and dental offices and other primary care offices to offer the vaccine, and then to help them to understand by educational processes that the vaccine is safe. I mean, we know that it's safe.
Absolutely. There's no question. I actually equate this to talking about smoking cessation. There's a lot of data out there that says really the only way that you're ever going to make any inroads is if you just continue to bring it up. And so if I'm talking about it in my office, you're talking about it in your office, pediatricians are talking about it in their office, that gives people enough exposure to, hey, these are people that I respect. I agree with their overall knowledge, and maybe we can make some inroads there. What is the biggest thing that you see as far as in your office on hesitancy of your patients and their family members?
I think some of the things you have mentioned, when we broach the subject with that, it's going to be, well, it's not needed, they're too young, they will never, you know, my kid's not sexually active. And then, of course, I think there are some people that just don't like vaccines in general. In this area, you know, it has a pretty high population. But I do agree with you in that I think that education is probably one of the biggest answers for us to be able to get the level up high enough to put this disease in check.
Yeah, I agree.
So say someone has been exposed to one of the variants of HPV and then becomes vaccinated. Does that help?
Yeah, I think that answer is yes and no. So again, as we spoke about, certainly being vaccinated before any exposure is best. But also, like we spoke about, that this is a multi-pronged vaccine that is active against 7 different serotypes of HPV high-risk vaccine or virus. And so you could be exposed to one serotype and associated changes to the body from there, but not be exposed to those other 6 types. And so vaccination still may be important. And that's actually why we've changed over the last now 7 years to extend that age so that it's more inclusive. Even though people have likely been exposed, if they've been active in their life and sexually active, they may not have been exposed to that whole range of the 6 or 7 serotypes. And so, yes, it is useful.
If someone does have an active one of the serotypes, are there treatments for that?
Absolutely. So certainly for the diseases that I treat, there is a long prodrome before cancer can happen. And so routine screening that we all are aware of, like pap smears and pelvic exams, certainly dental checks in your world. What about you? Are there things that you can do to prevent HPV related disease once they've been exposed?
Well, I think, and that's part of our recall system, is when we have people come in for their general prophylaxis, whether it's twice a year, once a year, 3 times a year, then one of the things that we always do is an oral cancer screening. And that is looking, in all the oral mucosas, the oral pharynx, for lumps and bumps and discolorations, growths and stuff like that. So hopefully that would be like an early detection type thing that would be able to be forwarded to the folks that help do head and neck cancers to take care of.
So I imagine you can only see so far down into the base of the tongue and into the rear palate. What kind of symptoms would somebody have for early problems there?
Well, I think that what they would do is they would develop some type of soreness to their throat. They may have a lymph node that may be swollen. They may have a little bit of hoarseness, a little bit of a cough, something like that. So those are things that we ask for in addition to visually inspecting all of the tissues in the mouth and the oropharynx. Let's go to the other side of the vaccine and say, okay, say you don't get the vaccine and you do get a cancer in one of those areas. I mean, we can talk about the oral stuff in a moment, but how devastating is that to someone to have it surgically fixed?
I would even specify even more as if we can surgically fix it.
Okay.
Unfortunately, for cervical cancer, there's about 5,000 women a year that die in this country from that disease. Vulvar and vaginal disease, similar type numbers, a little bit lower, but similar. And then countless number of people that have to go through very large and debilitating surgeries associated with these cancers that likely could have been prevented by vaccination. The same applies to the anal rectal region for sure. Penile cancer is much less common, but cancers that develop there can also be debilitating and certainly life-altering.
Do those type treatments also include radiation or chemotherapy?
Absolutely. That is on the list of possibility depending on the stage at diagnosis. Sometimes we can prevent these cancers from happening by diagnosing precancerous abnormalities, and so it's really important to follow up with any abnormal screening. Surgery is only a small component reserved for very small type of disease. Sometimes chemotherapy, radiation, or a combination of the two are the only things that we have available.
Yeah. On our side of that, when someone develops an oral cancer and has to have it surgically repaired, it can be devastating. It can be where you malformed. You end up having neck problems and all the scar tissue that comes along with that. And so I think your recommendation of having the vaccine certainly outweighs the possibility of having to have it treated later on down the road.
Absolutely.
So Dr. Kimball, what would you say would be the most important effectual thing that could get somebody on the right side of the vaccine by saying, I'm going to take my child to go see their doctor and get vaccinated?
Yeah, I think, great question. I think the most important thing in this day and age is making sure that we are relying on reliable sources of information. Everybody has an opinion. That doesn't make it right or wrong, but I tend to try and find the experts in whatever it is that I'm trying to find information about. Those tend to be people that deal with the disease and deal with the vaccination fallout and deal with vaccination administration, pediatricians, dental practitioners, OBGYNs. Those are going to be people that have great resources about this vaccine. And so if you're curious or if you're interested or if you have fears or concerns, I think it would be great to reach out to those people before we made a final decision.
Well, thank you. Thank you so much for being with us today and talking about this disease, and we appreciate what you do to help cure the disease as time goes on. And I'd like to encourage anyone that has small children to consider going to get the vaccine so that it can be protected and do well as they grow up and live a full and enjoyable life. Well, Dr. Williams, that was a very interesting and fascinating topic.
Well, it surely was. And if you have any questions about anything we've discussed today or any other topic we've discussed in the past, feel free to contact us. Our web address is right below here on the screen, as is our phone number. So give us a call. We'll be more than happy to talk to you. Thank you.